Right. Welcome and welcome to Metier Academy, one of the leading academy in training nurses in the nursing competitive exam as well as IELTS and NCLEX and OET training. Welcome back to Magic Pill session. As you all know that in Magic Pill session, we are discussing very important topics previously asked MCQs and the golden points related to that particular MCQ we are discussing in detail, right? Fine. So today also we are going to discuss very important topic. It is the most demanded topic because most of the time questions asked from this topic. So the topic is burns. Okay, so today the session what we are going to discuss, it is only part 1 and part 2 video. Soon it will be released. Okay, fine. So those who are keep on following our Magic Pill session, definitely they are going to get success in this exam, NORCET 9 examination. So watch all the videos, whatever we have posted already. இது வரைக்கும் நாங்க போட்ட videos எல்லாமே நீங்க பார்த்துட்டே இருக்கீங்க, அந்த flowலயே இருக்கீங்க அப்படினாலே உங்களால most of the questions you can solve it very easily. Okay, fine. So let's start with the thought of the day. Success is nothing more than a few simple disciplines practiced every day. See, let me give you some beautiful example. Few people used to start studying very fastly. ஒரு சிலர் வந்து வேகமா படிக்க ஆரம்பிச்சிருப்பாங்க. அந்த ஸ்டார்ட் பண்ணும்போது அவங்களுக்கு இருந்த அந்த வேகம் ஒரு 2 நாள் கழிச்சு இல்ல ஒரு வாரம் கழிச்சு இருக்காது. ஓகே, ஸோ இங்க என்ன சொல்ல வராங்க அப்படின்னா, so we need to practice every day. That sustaining is very, very important. Everyday discipline, everyday sustaining. If you are fixed, means every day morning I will wake up at this time and I will continue my studies whole day. I will have this timetable and I will follow this timetable. So this kind of discipline, if you are having, means definitely you can overcome any kind of barriers. ஸோ இந்த மாதிரி ஒரு டிசிப்ளின், அந்த டிசிப்ளினை நீங்கள் ஃபாலோ பண்ணணும். ஒரு சஸ்டெயின், நீங்கள் இன்னைக்கு நான் காலையில் இருந்து படிப்பேன், இன்னைக்கு நைட் வரைக்கும் நான் இந்த போர்ஷனை ஃபுல்லாக முடிச்சுட்டு தான் நான் தூங்குவேன், இதை வந்து நான் நெக்ஸ்ட் டே ரிவிஷன் பண்ணுவேன், எக்ஸாம் வரைக்கும் நான் இப்படியே தான் போக போகிறேன். ஸோ இந்த மாதிரி கண்டினியூஸாக இஃப் யூ ஆர் ஹேவிங் தட் focus continuously and if you are sustaining with that focus continuously, definitely you can easily succeed in your examination. Okay, so with this thought of the day, let's begin the session. As I mentioned the topic already, it is burns MCQ part 1. Most important MCQs and vital points we are going to discuss. The MCQ what we are discussing is already asked in the previous year question paper repeatedly. Okay, fine. So the first question is, already I said to you guys, check for the key points. If the question size is very huge, the question size it is coming in 6 or 7 lines, doesn't matter. Okay, just check for the key points and easily you can answer the question. Let's go with the simple to complex questions. A 32-year-old male is brought to the emergency department after a house fire. He has burns over his face, neck and chest. This is very important point. So house fire, that is the first key point. It is, the person is inside the house and everywhere the fire is happening. So the person is inhaling the carbon monoxide. Okay, so it's a type of carbon monoxide poisoning. During the carbon monoxide poisoning, what will happen? Your airway, the upper airway and lower airways, it is going to get damaged. So this concept should come into your mind. That presence of mind is very important. Come into your mind immediately while you are seeing these kind of key points. Okay, he is having hoarseness of voice and singed nasal hairs, burned nasal hairs, very important key point, and coughing up the carbon tinged sputum. Okay, so the color of the sputum is totally different. Okay, so these are all the key points which we will make us to think about carbon monoxide poisoning and upper airway edema. The chances of upper airway edema is very, very common in case of house fires. Okay, and also the patient is having what? Signed nasal hairs and burns over the face, neck and chest, and coughing the carbon tinged sputum. This one will have to think about the upper and lower airway damage. Okay, and second point is carbon monoxide poisoning. Okay, fine. So let's see what are all the options they have given here. They are asking the priority nursing action. So priority first, what we supposed to do, that they are asking here. Start large bore IV and begin the fluid resuscitation. Obviously, we are going to start with the fluid resuscitation. Okay, in the emergency period, one type of fluid resuscitation will be there, and followed by that, another type of fluid resuscitation will be there. Okay, and apply oxygen via nasal cannula. Definitely, oxygen administration should be there, and preferred for endotracheal intubation. Okay, cover the burns with sterile dressing. See, all the points are correct, but according to the priority, which one has to keep or come first. So that is the very important point. See, here there is a most chance for upper airway obstruction because of edema. Nasal air sign means burnt nasal hair. It shows that the person already inhaled the heat or hot fumes. Okay, already their nasal, upper airway, lower airway, everything is damaged. So once the airway is damaged, definitely edema formation will be there. If there is a edema occurs in the upper airway or lower airway, what will happen to the respiration? It is going to get obstructed because of the edema. So in that case, the first and foremost thing what you're supposed to do is you have to intubate the patient. After intubating only, you have to start with the oxygen administration. Okay, and then also we have to start with the fluid resuscitation. So first intubation, followed by that connect the patient in the ventilator. It will take care of tidal volume, pressure, each and everything. And the rest of the thing is IV fluid resuscitation. So the first and foremost thing what we supposed to focus here is prepare for endotracheal intubation. So here the right answer is going to be option C, that is prepare for endotracheal intubation. Okay, fine. And the rationale already I have given here. The signs of inhalation injury. These are all the key points you're supposed to remember. Facial burns, scent, nasal hair, hoarseness of voice, and carbon tinged sputum. So if these words are present in the question, means you have to think about what? Intubation. Okay, so these are all the red flag signs of upper airway obstruction. It will cause what? Swelling. So immediately we have to focus on airway, breathing, and circulation. So I have focused on A, B, C. That's why I have selected what? Option C. Obviously, as I mentioned already, IV fluid and oxygen administration should be there in order to stabilize the patient. But still, the first management is going to be endotracheal intubation. Okay, so this is how you have to solve the question, guys. Okay, fine. So hope you understand the concept. The second one is the patient weighing 70 kg. See, very important here in this question, we are going to use Parkland formula. Parkland formula. See, most of the exam, they have asked question related to Parkland formula, guys. Okay. The patient weighed 70 kg. This is the first key point. And has sustained at 25% of total body surface area. Okay, so this is the second key point. If you know the Parkland formula and if you know the weight and the total body surface area, easily you can solve this question. Okay, so here the Parkland formula is being used for fluid resuscitation. So this is the clearly they have mentioned here we have to use the Parkland formula. How much fluid should be administered in the first 8 hours? Always keep in mind, guys, in Parkland formula, Parkland formula, see, first 8 hours and second 16 hours management is very, very important. So whatever the value we are getting from the Parkland formula, it has to be divided by 2. For example, after substituting all the values, if you are getting 1000 ml, okay, for example, I'm telling, so that 1000 ml has to be divided by 2, so that you will be getting what? 500 ml. You are getting what? 500 ml. So what I want to say is this 500 ml has to be used in the first 8 hours and second 500 ml has to be used in the second 16 hours. Okay, fine. See, you are adding this, you are substituting all the values in the Parkland formula and you are getting a number. For example, you are getting 5000 ml. 5000 ml as a answer. So 5000 ml, you have to divide it by 2. And in that case, you will be getting 2500 ml. So 2500 ml we have to give to the patient in the first 8 hours and second 2500 ml we have to give in the second 16 hours. Okay, let's see how we are going to calculate each and everything. Okay, fine. So let's start with the formula. So already I will give the answer. The answer is 3500 ml. This is the correct answer. So how we got this answer? Let's see in detail. See, this is the Parkland formula, guys. The first important point here is always we are going to use the Ringer lactate solution if for the burns patient. First important point, Ringer lactate solution we are going to use for the burns patient. Okay. Second important point is formula. Sometime in the exam they can ask the formula directly also. So the formula is 4 ml into body weight into total body surface area. This 4 ml is default. Okay, definitely it will be there. 4 ml. Always the formula, Parkland formula, it will start with the 4 ml. So 4 ml into body weight. What is the body weight? 70 kg. So here you have to substitute 70 kg. Okay. And the total body surface area, how much it is? 25. So 25 is the total body surface area. Just substitute it. 4 into 70 into 25. How much we are getting? 7,000 we are getting. Okay. So total value, how much you are getting? 7,000. Okay. So here in this question, what they're asking, first 8 hours, how much we supposed to infuse? Okay. So already I have said that Parkland formula, here we have to do divide into 2, that is first 8 hours and second 16 hours. Okay, so in this question, what they're asking how much we have to infuse in the first 8 hours. So if they are asking like this, means directly you just divide the number what you got. So what number we have got? We have got 7,000, right? So 7,000 divided by 2. So that what we are getting? 3,500 ml. So in the first 8 hours, we will be infusing 3,500 ml, and in the second 16 hours, also we are infusing 3,500 ml. So 3,500 plus 3,500, you will be getting this value 7,000. Understand? Yes. So if you are having confusion, please watch again and again. Once again, I will repeat, just substitute all the values, whatever they have given here. Okay. At last, after substituting, you will be getting the answer like this, 7,000 ml. This 7,000 ml, they are asking for first 8 hours. So first 8 hours, if they are asking, means 7,000 divided by 2, then you will be getting what? 3,500 ml we have to infuse in the first 8 hours. And again, 3,500 ml we have to infuse in the second 16 hours. Okay, second 16 hours. Here clearly it is mentioned of in the first 8 hours 3,500 ml, remaining 3,500 ml over the next 16 hours we have to infuse to the patient. Okay guys, see from the Parkland formula, so many questions are asked so far. So because it is very, very important, please make a note of it. And also rule of 9 is very, very important for your examination. Adult rule of 9, pediatric rule of 9, both are very, very important. Okay, fine. And the next question is, yes, a 45-year-old burn patient in the acute phase suddenly developed peaked T waves. See, two phases are there. That is, acute phase. Acute phase, it will continue up to 48 hours, and followed by that, hypovolemic phase will be there. Okay, hypovolemic phase. So we will discuss about that later. So now you just think like, acute phase, there is a sudden develop of peaked T wave. Okay, there is a peaked T wave on ECG, and muscle weakness is present. Which electrolyte imbalance is most likely causing this peaked T wave? Very simple. Already we know that peaked T wave is caused because of which electrolyte imbalance? Hyperkalemia. Okay, so here the right answer is going to be what? Option B, that is hyperkalemia. See, in the burns acute phase, that is in between 48 to 72 hours. See, 0 hours to 48 hours, we are going to consider it as what? Acute phase. In this acute phase, what will happen? Clearly I have mentioned here in the rationale. In the early phase of the burns injury, acute phase is also called as what? Early phase in the burns injury, the cells are damaged. Cells are damaged. See, the cells are damaged. Okay. See, potassium is the intracellular electrolyte. If the cells are damaged because of the potassium, because of the burns, if the cells are damaged because of the burns, the potassium will come out of the cell and it will enter inside the blood vessel. The potassium will come out of the cell and it will enter inside the blood vessel. So in the blood vessel, the potassium level, it is going to be increased. Inside the blood vessel, the potassium level, what will happen? It will increase. Whenever the potassium level is increased, what will happen? In the ECG, tall T waves, that is peaked T waves will be there. Clear guys? Yes, fine. So in the acute phase, hyperkalemia will be there, and in the recovery phase, this is also very important guys, recovery phase, hypokalemia will be there. In the acute phase, the cells are damaged, potassium came into the blood vessels. That's why hyperkalemia. Whereas in the recovery phase, totally the concept is different. The patient will go for hypokalemia. Why hypokalemia? The rationale is clearly I have mentioned here, very important. See, the hypokalemia in the recovery phase, it is due to IV fluids. We are going to infuse more amount of IV fluids, ringer lactate, to the patient who is suffering from burns, right? Because of this IV fluid, the potassium is going to get diluted. So in that case, we used to say it as what? Hypokalemia. Okay, and also the potassium is leaking out of the damaged wound which is not in contact with the blood vessels. Okay, so in that case also the potassium is loosed from the body. And also aldosterone, once in the recovery phase the kidney is getting adequate amount of blood flow, the adrenal gland is getting adequate amount of blood flow, means aldosterone what will it will do means it will absorb the water and it will excrete the potassium. It will absorb the sodium and it will excrete the potassium. Okay, see, all these things it will happen in the recovery phase, not in the acute phase. Okay, so in the acute phase hyperkalemia and in the recovery phase hypokalemia. So this is the difference between these two phases. Okay, fine. And tall T waves always, peaked T waves always caused because of what? Hyperkalemia. If you are not treating this hyperkalemia, cardiac arrest will take place. Cardiac arrhythmias will take place. Please remember this. Okay, fine. Next. A patient with full thickness circumferential burns to the lower leg complains of severe pain in the lower leg circumferential burns. Full tie there on full lower leg there is a burn injury, that is a thick circumferential burns. Okay, fine. So the patient is having severe pain, numbness, and the nurse notes pale, very important point, pale cold toes with absent dorsalis pulse. See, there is no pulse and the skin is very cold. Okay, and it is totally pale in color. All these key points will think about what? Lack of blood flow because of compartment syndrome. See, what is circumferential burns? Consider this is a hand. Okay, so all over the hand burns are present. Total hand, what is present? Burns are present. Because of the burns, scar tissue formation will be there. Scar tissue formation means it is a dark, leathery, thick tissues which is formed around the arms. Okay, and it will give compression over the muscles. So if the muscles are compressed, what will happen? The blood vessel which is running in the blood muscles, it will going to get compressed. Once it is compressed, the distal part will not get the blood flow. The same mechanism is happening in the lower leg in this question. Okay, so in this scenario is there, means it is called as what? Compartment syndrome. Okay, so in this compartment syndrome, if there is no pulse, what we supposed to do immediately? We have to inform to the physician immediately, and the physician will do fasciotomy, otherwise escharotomy. What is that? Escharotomy, removal of the tough tissues. That is called as what? Escharotomy. Okay, you can see here, this is the classical compartment syndrome, because in this scenario, it is going to think about what? Compartment syndrome. Say, always remember, compartment syndrome means you have to think about what? 5 P's, that is pain, pallor, paralysis, pulse, and poikilothermia. Okay, so all these things you have to keep in mind. What is poikilothermia? Because of the burns, the body is adapting to the room temperature. If you are sitting in the cold room, then whatever the temperature of the room, it is going to get absorbed by the body. If you are sitting in the hot room, your body is going to absorb the environment temperature. A simple term, poikilothermia means unstable temperature. The body is going to accept the environmental temperature and the body will not maintain its own temperature. That is called as what? Poikilothermia. Please remember that. So in case of compartment syndrome, you have to check for these 5 P's. Okay, fine. Next question. A burns patient in the rehabilitation phase is on oral diet. See, diet questions are very common nowadays, guys. That's why I have added this question. So which dietary advice should the nurse reinforce for the optimal wound healing and recovery? For fast wound healing and recovery, what type of diet you supposed to give for the patient? This is the question. You need to take low fat, high carbohydrate diet. Whether the low fat and carbohydrate diet is going to enhance the healing? No. Focusing on eating fruits and vegetables. If you are eating fruits, vegetables, okay, that is well and good. But whether it is going to enhance the healing, you need a high calorie and high protein diet with vitamin supplements. Yes, we have to think about the protein rich diet, right? And also high calorie, because the body is in need of high calorie carbohydrate rich diet, because already the cells are damaged, so hypermetabolic state will be there inside the body. Okay, so it needs more energy. So high calorie, high protein diet has to be taken. High protein diet, why we supposed to take? It enhance the wound healing. Okay, drink plenty of water and avoid protein. Avoid protein. We should take protein. We should not avoid protein. Yes, obviously we can drink plenty of water, but we should not avoid the protein. Okay, so on the whole, by scrutinizing the answer, here the right answer is going to be option C. That is, you need a high calorie, high protein diet with vitamin supplements. Okay, and see here, option the C is the right one. The rationale also I have given here. Burns patient or in hypermetabolic state. The cells are damaged. It needs more energy. Okay. So what we supposed to do? We have to give high calorie, high protein, even vitamin A, C, and zinc supplement. Zinc is very, very important for supporting the collagen fibers. Collagen fibers is very important for forming the new tissues, new cells. Okay. For forming the new cells, collagen is needed. For the maturation and activation of the collagen fibers, zinc is needed. So vitamin A, vitamin C, zinc, high protein, high calorie diet, all together we have to give to the patient. Okay, fine. So this is all about the oral, and I would like to add one more question also before that. So far, whatever the question we have discussed, as a summary, I'm going to conclude here. See, always remember, in emergency phase, in burns emergency phase, we have to focus on airway, breathing and circulation. And during resuscitation, fluid resuscitation, you have to think about the Parkland formula, 4 ml into body weight into percentage of total body surface area. Okay, fine. Always we have to use the Ringer lactate solution. Please remember those things. In acute phase, hyperkalemia will be there, and in the recovery phase, hypokalemia will be there. Circumferential burns means definitely compartment syndrome chances are there. You have to check for 5 P's. Okay. And rehabilitation phase, we have to focus on high calorie, high protein, vitamin A, vitamin C, zinc rich foods. Right? Fine. So, and one more brainstorming question. Please answer this question in the chat box. Okay. So I will give this answer for this question in the next session. So whoever knows the answer for this question, please drop your answer in the chat box. Let me explain about the question. A 25-year-old man is admitted with 50% of total body surface area burns following an electrical accident. On the 3rd day of admission, he suddenly develops. On the 3rd day, he admitted in the hospital and suddenly develops fever, tachycardia, hypotension, decreased urine output, and wound appears brownish, purulent drainage is present. And here they are asking the most likely complications. If these signs and symptoms are present, means what is the most likely complication the patient can get? Hypolimic, shock, sepsis, acute kidney injury, and curling ulcer. So these are all the 4 options. So which is the right one? Please drop your message in the chat box. Okay, guys, fine. Hope everyone understood the concept. This is only part 1 video. Part 2 video will be released soon. And if you want any demanding topic, if you want to ask me, please, that topic also please drop in the chat box. In the next session, we will discuss about that topic. Any doubtful, complicated topic you are facing while you are studying the content, you can drop that topic also. We will be discussing about that. Okay, don't worry about all those things. And keep on preparing for the exam. Sustaining is very, very important, guys. Every day you have to maintain that discipline. Be honest to yourself. Okay. So thank you very much, and all the best for your upcoming examination. Keep preparing. Thank you, guys.